Welcome to the Nurse Edu Network. My name is Janae. In this video, I will review Domain 1, Facilitate Learning. Since this domain is the largest, I will be breaking it down into multiple parts. On the exam, this domain will consist of about 47 questions. In this presentation, we will focus on subcategory A of Domain 1. By the end of this presentation, you will be able to implement a variety of active teaching and learning strategies appropriate to content, concepts, setting, learning attributes and needs, learner outcomes, and method of delivery. The nurse educator first needs to determine what needs to be taught before identifying a teaching strategy to meet a learning outcome. Does the content require acquisition of knowledge, skill, or attitude? The next step is to identify the setting or learning environment the content will be covered in. If the content is theory-based, then the classroom would be the best location. In the skills or simulation lab, students can practice skills and use critical thinking skills. The clinical environment is an excellent opportunity for students to apply what they learned in the classroom and lab on real patients. The nurse educator needs to consider gaps of knowledge that students may have. Students come from diverse backgrounds and may have previous health-related knowledge. Some students may have learning disabilities that the nurse educator must consider. Students are not always aware of what they need to know, so it is the nurse educator's role to identify educational needs. To ensure that all learner needs are met, nurse educators should use various teaching strategies. The Done and Done model states that there are 5 stimuli that affect student learning, and they are environmental, emotional, psychological, sociological, and physical. Environmental involves taking stimuli into account and asking where students prefer to learn. For example, some students prefer the formal in-class learning, while others prefer informal learning from home. The emotional aspect involves levels of motivation and responsibility. It is how the student conforms and pursues a task until it's complete. Also, the types of structures that are helpful for the learner. Sociological aspects deal with how the student learns best, whether it is alone, in pairs, or in groups. Also, do they learn best with or without guidance from the instructor is something else to consider. Physiological is about how the body responds to learning. Some students are more alert at specific times of the day, depending on what they have eaten or not eaten. It also has to do with students' learning styles, such as visual, auditory, or kinesthetic. The psychological element has to do with how the learner responds to new information and ideas. Is the learner more analytic or global, which is preferring to see the big picture? Is the learner reflective and prefers to quietly reflect on the content? Is the learner impulsive and constantly raising their hand to ask questions? Some common learning styles are visual, auditory, read, write, and kinesthetic. Visual learners will learn best with PowerPoints, diagrams, observing skill, concept maps, or videos. Auditory learners will learn best with lectures, podcasts, and discussions. Read/writers learn by reading and taking notes. Kinesthetic learners prefer to be hands-on and learn best with role-playing and return demonstrations. Kolb's learning model focuses on how experiences, including our thoughts, emotions, and environment, impact the learning process. Concrete learning is when a student has a new experience or interprets a previous experience in a new way. A nursing student applies a skill learned in the simulation lab on a real patient. Reflective observation is reflecting on a new experience to understand what it means. For example, a student may reflect on a skill they performed and how they could have done better. Abstract conceptualization is when the student adapts their thinking or constructs new ideas based on their experience. For example, the nursing student realizes next time they perform a skill, they need to make sure they have all the supplies that are needed. Active experimentation is when the learner applies the ideas they learn to real-world situations. For example, the student may notice how smooth a skill is completed when they have all their supplies ready. Learning outcomes are the starting point for the teaching plan. In order to determine what to teach, the nurse educator must determine what they want the students to learn. They determine what knowledge, skills, or attitude the student needs to obtain. Teaching strategies should be aligned with learning outcomes. The nurse educator should also use Bloom's taxonomy when creating outcome statements. I will go into depth review of Bloom's in future presentation. The last aspect that affects teaching strategies is the method of delivery. Face-to-face is the most common form. Distance education is when the educator is not at the same place as the students. It can be asynchronous, where the educator and students log in at any time, or it can be synchronous, where they log in at the same time. A blended learning environment is when face-to-face is combined with distance education. A flipped classroom involves active learning. The traditional lecture and direct instructions are not used in the classroom. Students review content before class, which frees classroom time for activities that involve higher learning. Simulation is what we already are very familiar with. Service learning is when students participate in a community service. Content involves what needs to be taught. It can be knowledge, a skill, or a change in attitude. The setting of learning is where the actual learning is taking place. It can be the classroom, simulation lab, or even at home. Learning needs have to do with gaps of knowledge that the learner has to get to the expected level of knowledge. The nurse educator uses various teaching strategies to meet the needs of learners. The nurse educator should also consider the learning styles of students. Learning outcomes should be used as a starting point to create a teaching plan. Lastly, the method of delivery should be considered. For this presentation, I used Chapter 1 of Caputi's review book and Chapter 4 of Bastable's Nurse as an Educator. In the next presentation, I will be reviewing evidence-based teaching strategies.